Today we will be doing sterile field and urinary catheterization. So I'm coming into the room, performing hand hygiene. I'm introducing myself to my patient, and I'm going to provide some privacy. I'm checking to make sure that the bed is locked, the room is safe, my patient's in bed properly, and then I'm going to ask her name and date of birth. And she should be having a wristband with her name and date of birth on it that matches, so I'm going to check that. And then I'm going to ask if she has any allergies or if she's in any pain. I've already verified the order for our Foley insertion, and so I'm going to don some gloves and explain the procedure to her. I've brought in all my supplies, so I've got my Chuck's absorbent pad, I've got my Foley tray kit, and I brought in some tape and a bath blanket. I'm going to put the bed up to a comfortable working height. And since this is a sterile procedure, I'm going to put the bed up pretty high. All right. And you only want to expose what needs to be exposed in this. So that's where the bath blanket comes into play. You can lift up your patient's gown, and then we'll put the bath blanket right here over her legs. And then you're gonna have your patient open her legs just a little bit, and then slide your absorbent pad underneath her legs. And just for the purposes of this video, I'm going to put the bed down a little bit just so that you can see a little bit better. All right, so we've got that all exposed. You would clean the perineum if needed. And then once you do that, you'll take off your gloves, bring our trash can nice and close, and then perform hand hygiene. And now I'm going to take my kit and get it ready here on my side table. And I'm going to bring this table over here so I don't have to turn my back to my patient. Some people just throw this away, but I like to use it as a little trash bag while I'm doing all this. You want to open all this away from you, only touching the 1-inch border. All right, you'll see that the sterile drape is on the top, so touch the 1-inch border and open it up, and you're going to want to place it underneath your patient, trying not to touch skin or anything like that. And you're not sterile at this point, but you want to try to be as careful as possible. All right, then I'm going to go ahead and take this out. I don't use this, sometimes people do, but you're not required to. All right, now I'm going to perform hygiene. Excuse me. Take out our sterile gloves. Again, you only want to use the flaps to open these up. Just grabbing the outside border. These sterile gloves are kind of universal, so if you have a preference of size, you can always bring in your own sterile gloves when you're inserting a catheter. All right, so now I'm sterile, so now I can touch all of this. So certain packets come with cotton balls, some come with swab sticks, but what you're gonna do is you're gonna open this iodine solution. So pretend we've got that open. Prepare that. You're gonna open up your lubricant, get that ready. This has a specimen cup if you have an order to get a urine sample. And then we're gonna attach this to our balloon port. This is the water that you will use to inflate the balloon once the catheter is inside your patient. So you've got that ready. And then you can go ahead, oops, it popped right off. There we go. You can go ahead and take this blue casing off, being very careful with the tip of your catheter. That could be trash. And you'll go ahead and take this and put the lubricating jelly on, and I like to just stick it in the case. There we go. All right, so one of your hands is going to become non-sterile, so I'm going to use my left hand since I'm right-handed. And I'm going to go ahead and dip each cotton ball into this iodine. And then you're going to go ahead here and spread the labia with your non-dominant hand. And with your other hand, you're going to do one swipe down. Go ahead and dip. Another swipe on the other side. And then one final one in the middle. And that's just helping to clean the labia so that it can be nice and sterile for when you're ready to insert. So now this hand is not sterile, so I cannot touch anything in my kit. I'm gonna go ahead, make sure there's enough lubricant on the tip of my catheter. And I'm gonna bring this all the way over here. All right, so this part is sterile. And you're gonna wanna insert it into the urethra, and then you see a flash of urine in your bag. And so you're gonna wanna keep inserting it another 2 inches. Once you've done that, you can go ahead and inflate the balloon. And then once your balloon is inflated, you'll tug on it, make sure it's in place, it's not coming out. All right, perfect. And then you'll go ahead, some kits have a stat lock that helps to lock the catheter into place. I'm just gonna tape it here to the leg just to make sure it's in place. And now you can see, hopefully there's urine draining into your bag. And usually your patient will be relieved. It's all over. So whenever you have this bag, you want to hook it underneath. Usually the beds have a spot for the catheter. You want to unhook it underneath the patient, right there, on something that's not movable so that it doesn't yank the catheter out. And you want to clean up all of your supplies. Put that all in your trash can. Take your gloves off. Uniform hand hygiene. And then get your patient in a comfortable position. You can remove this Chuck's pad. And you want to do that while you still have gloves on, just in case there's anything on it. And then this syringe you can toss now that the balloon's inflated. All right, put our patient's bed back down, make sure that she's comfortable, ask her if she needs anything. And then we'll give her her water and her colite. She's got her colite right here. And I'm gonna perform hand hygiene one last time after touching all that. And then I'm gonna document the time and date that I inserted the catheter. I'll document how the patient tolerated it, if there was any urinary output, the color of the output, if there was any odor, and you'll document all of that in your electronic medical records. Thank you.